Okay, everyone. So as Cindy said, we're going to be discussing diabetes today. We're going to specifically focus on type 2 diabetes as that is the only kind that is preventable and reversible. But we're going to discuss the three main types of diabetes first. Diabetes is due to either the pancreas not producing enough insulin or the cells of the body not responding properly to the insulin that is produced. This causes sugar to stay in your bloodstream in that case, well, in either case. The three main types of diabetes is type 1, and that one has no identifiable cause. It's actually something you're born with. So that's why I'm not going to discuss it too much because it's not something that you would be able to change or to improve. It's something that happens to your body naturally. But type 1 results from the pancreas's failure to produce enough insulin. This form was previously referred to as insulin-dependent diabetes mellitus, which is a mouthful, obviously, or juvenile diabetes, because it usually occurs once you reach childhood. It's something you're born with, but you don't really experience any symptoms of it till several years of life. Type 2 is preventable and reversible and begins with insulin resistance, which is a condition in which cells fail to respond to the insulin properly. As the disease progresses, a lack of insulin may also develop. This form was previously referred to as non-insulin dependent diabetes mellitus or adult onset diabetes. We usually just say type 2. It's easier. Lastly is gestational diabetes. This occurs only in pregnancy, usually after the second trimester. This is when you form high blood sugar during pregnancy, of course. Women who develop gestational diabetes are more likely to develop diabetes later in life. So if you're in your 20s, you get pregnant, you develop gestational diabetes, after the age of 40, you're more likely to actually get type 2 diabetes. So this here gives a demonstration of the two types of diabetes. So on the left-hand side is type 1, and you see there's no insulin that's actually produced on that side. On this end, insulin is produced, it's just not being utilized properly by the body. So that's the difference between type 1 and type 2. So what is insulin? So I wanted to make sure that we have a thorough understanding of what insulin is. When we hear insulin, we usually think of the medication that is injected into our bodies. And a lot of my patients think that's all insulin is, it's just a medicine. Insulin is actually a natural hormone that our bodies produce. So when you inject insulin, you're injecting a hormone into your body. It's produced by the pancreas. It helps glucose in your blood enter cells in your muscle, fat, and liver where it's used for energy. Glucose comes from the food we eat. The liver also makes glucose in times of need, such as when you're fasting. When blood glucose, also called blood sugar, levels rise after you eat, your pancreas releases insulin into the blood. Insulin then lowers blood glucose to keep it in the normal range. So insulin is very, very important because it's the hormone that helps keep all of our organs functioning properly. And in this photo, on the left-hand side, you can see the insulin floating up there. It looks like a little yellow UFO. And then the glucose next to it. So that's what a cell there on the bottom. The insulin has to be absorbed into the cell in order for the sugar to be absorbed. So then you can use that for energy. So if you're not absorbing the insulin, the sugar stays in your bloodstream. Your cell actually blocks it out so then it cannot be used for energy. So insulin resistance. When cells in your muscles, fat, and liver don't respond well to insulin and can't easily take up glucose from your blood. So that's what that is. So insulin resistance is when you are producing insulin, your cells are just not absorbing it. So that's the difference between type 1 and type 2. So type 1, you're not making any insulin. Type 2, you are, but it's just not being utilized. As insulin resistance develops, your body fights back by producing more insulin. So over months or years, the beta cells in your pancreas that are working hard to make that insulin, they get worn out. So your cells are blocking the insulin from being absorbed. Your body notices that, like gets a notification that, hey, I don't have that energy, what's going on? So it produces more and more insulin. So then your body will start to absorb, your cells will start to absorb it. But the thing is, your cells are blocking it. So your pancreas is working really, really hard to make that insulin, thinking it's not being produced, which is why there's that cause for no absorption. But you end up wearing out your pancreas in the long run because it's trying to keep up with those levels. So years after insulin resistance silently began, your blood sugar may begin to rise and you may develop prediabetes or type 2 diabetes. So these are the causes of insulin resistance. There are two different categories. There are controllable causes and uncontrollable causes. On the left-hand side, you can see the uncontrollable causes are genetics, aging, and ethnicity. With ethnicity, that one's kind of up for debate because scientists don't know if it's necessarily our ethnicity and in our DNA to be more likely to develop diabetes. Usually people of color, so Hispanics, African American, we're more likely to develop diabetes. And they don't know if that's because of our DNA and our genetic code or if it's cultural, based off of what we eat, what we consume in our lifestyle. So that one is kind of up in the air. We're not really sure yet. But a lot of what we eat has carbs, tortillas, beans. I can't think of very many Mexican dishes that have fruits and vegetables or not a lot of carbs. We cook in oil. All of those things are not good for us, and it's a cultural thing, so that's why that one they're not too sure about. But the controllable causes are excess body weight, specifically too much belly fat around your core. The reason being is, we all come in different shapes and sizes. We carry our weight differently, but if you are somebody who carries your weight around your midsection more than anywhere else, you're more at risk for becoming insulin resistant and developing diabetes. Because when the fat surrounds your organs have to work harder in order to keep up at a normal pace. So it strains your organs when you carry it in your throat. Lack of exercise, smoking, and lack of sleep. 1 in 3 Americans are insulin resistant. It's a pretty high number. Signs and symptoms. So the number one is a large waist. So that's like the number one red flag. If you have a lot of weight in your midsection, you're more at risk. A waist that measures 35 inches or more for women, 40 or more for men, you're at high risk for insulin resistance. According to the National Institutes of Health, in addition to a large waist, if you have 3 or more of the following, you likely have metabolic syndrome, which is what creates the insulin resistance. So if you have high triglycerides, levels of 150 or higher, low HDL, which is low density lipoprotein levels below 50 for women and 40 for men, or if you have high blood pressure, readings of 130 over 85 or higher, or if you develop dark skin patches. So I'm sure you guys may have experienced or may have seen somebody who has like a dark neck or dark elbows, dark underarms. For us, it's usually a concern because of the aesthetic. It looks like, possibly poor hygiene. That has nothing to do with hygiene. It's actually a warning sign from your body. When you develop those dark skin patches, it's because your body is becoming insulin resistant. So prediabetes. So as I had mentioned, one out of 3 adults have prediabetes. That's 86 million Americans that have it. 9 out of 10 people don't even know that they're pre-diabetic. So prediabetes is when your blood sugar is high, but not high enough to be classified as diabetes, official diabetes. So you're borderline, you're at risk, and you really need to start trying to reverse the damage that has been done. Seeing as though type 2 is caused by things that we do or don't do. That's when we would have an opportunity to try and prevent it from going to actual diabetes. Prediabetes occurs in people who are insulin resistant or whose beta cells in the pancreas aren't making enough insulin to keep blood glucose in the normal range, which is when I had mentioned when your body's trying really hard to produce more and more insulin, and then it eventually just kind of stops working so hard it gets worn out. So either your body's not responding well or the pancreas is just kind of slowed down. Without enough insulin, extra glucose stays in your bloodstream rather than entering your cells. So over time, the extra sugar in your blood results in type 2 diabetes. Now we're going to discuss type 2 diabetes, and it is a condition in which a person's blood sugar levels are too high. So I think we're all pretty familiar with that part of diabetes, maybe not the insulin part. But when there's too much sugar in your blood, your cells are not absorbing the sugar to use for energy, so it just stays in your bloodstream. This is a very big problem for your overall health because the glucose in your bloodstream will stay there. it does not go to your blood vessels. It can cause damage to your vessels and nerves because it's not being absorbed for energy by your organs, by your muscles, by your tissue, by your vessels. So sugar is not bad in moderation, especially like natural sugars from fruit. But if your body is not using that energy or using it for energy, it sits in your bloodstream and can cause damage. Complications of unmanaged diabetes would be heart disease, stroke, kidney disease, eye disease or blindness, nerve damage, which raises the risk for amputation. So if you're not managing your diabetes, or oftentimes people don't even know that they have diabetes until something extreme happens, they have a stroke or one of these happened, blindness, nerve damage. My stepdad's diabetic and he did not know he was diabetic until he went into a diabetic coma. And he was hospitalized for a while, and that's when he was like, oh, well that explains all of these symptoms that we kind of ignore because they seem like fairly common things. So in the symptoms, the following symptoms are typical, but like I said, they kind of go unnoticed because they don't seem that bad. So urinating often, that's a big sign. But if you drink a lot of caffeine, that causes dehydration, but it also makes you flush out more, so you may not notice. Also, if you stay hydrated, you drink a lot of water. I drink over a gallon by noon, so I'm back and forth constantly, and that's something that somebody who's diabetic wouldn't really notice as a red flag. Feeling thirsty, feeling very hungry even though you're eating, that's a big red flag there because your body feels hunger when you need energy. So if you feel hungry, that means that your body needs to refuel. If you're eating and you still feel tired and your stomach is full, that's because your body is not using that food properly and will lead to extreme fatigue. Blurry vision, cuts or bruises that are slow to heal. So that's also a big one there. Because your cells are not working properly, since they do not have the energy that they need, you'll heal slowly. If you cut yourself, you won't coagulate very fast. If you get a bruise, you can bump your arm and all of a sudden you have a gnarly bruise, even though you maybe didn't bruise that easily before. Weight loss occurs usually with type 1 diabetes, and another red flag for type 2 would be tingling pain or numbness in the hands or feet. So it's important to get diagnosed. I know a lot of people usually avoid seeing their doctor for their regular exams unless something's wrong with them. A lot of people don't go to the doctor unless they're sick, unless they're afraid that they may have something, or as you get older you become more concerned with your health. But it is important to get diagnosed with any type of disease you may have. So checking your blood pressure, your cholesterol, your diabetes, those are the three main and most common diseases that we see in America that usually don't get diagnosed until later in life when they could have been caught early on, maintained, and sometimes reversed, or at least well managed. But in diagnosing diabetes, there are 3 different tests to do so. Of course, all of them require you to see your doctor. So the A1C test measures your average blood glucose for the past 2 to 3 months. The advantages of being diagnosed this way are that you don't have to fast or drink anything unpleasant. Fasting plasma glucose, this test checks your fasting blood glucose levels. So that means that you can't eat or drink anything for at least 8 hours before the test. It's a little bit more inconvenient unless you're able to do the test first thing in the morning. And this one, if you have blood glucose greater than 126, that would be classified as diabetes. The oral glucose test is usually done in pregnancy. That's when you have to drink that really sweet liquid. If anybody has kids in here or how to do this, you drink a really sweet liquid. They check your blood sugar before and after to see how your body responds to it to diagnose the gestational diabetes. Now we're going to get into treating. This covers treating as well as preventing and kind of reversing, because this is something that happens to us that we kind of do to ourselves. There are other factors, of course, like genetics and whether it's hereditary, if it runs in your family. But if we take care of ourselves, we can help our diabetes or prevent it. So of course, eating a well-balanced diet. So that applies to everyone. Healthy eating includes eating a wide variety of foods, including vegetables, whole grains, fruits, non-fat dairy products, beans, lean meats like poultry and fish. Those are all good to eat. When you're diabetic, it's important to watch your carb intake Even if you're trying to lose weight, it's important to watch your carb intake. Carbs turn into sugar, and sugar turns into fat. So if you're trying to lose weight, watching your carbs, restricting them to 20 or less is ideal. If you're diabetic, you just want to monitor your carb intake, just because, like I mentioned, it's going to turn into sugar. So when your body digests it, it turns into sugar. And then these have some superfoods that doctors recommend for us to eat, which we did cover on the last slide, so we'll get into it. But it is really good to try to eat as many healthy fats as you can and low carb when you're diabetic. And to exercise, of course. Insulin sensitivity is increased, so your cells are better able to use any available insulin to take up glucose during and after activity. When your muscles contract during activity, it stimulates another mechanism that is completely separate of insulin. This mechanism allows your cells to take up glucose and use it for energy, whether insulin is available or not. So that's very beneficial for anybody with diabetes. Doctors recommend that you spend 30 minutes every day walking. So you want to start with a 5-minute warm-up. Push yourself a little bit, maybe go for a light jog if you can, and then check your blood sugar before you start your exercise. And then after you do maybe a walk or some type of cardio, have like a 5-minute cool down period and check your blood sugar afterwards to see the effect of your exercise. This one is really, really interesting to me because I didn't really know this until I was preparing the presentation. But sleeping well, of course, I know we all need sleep. It helps our body, it's good for us. But it makes a really big impact with people with diabetes. So you should be sleeping 6 to 8 hours every night. I know not everybody gets that much sleep, or sometimes they'll sleep a few hours at night and then maybe nap during the day, but we need a consecutive 6 to 8 hours of sleep every night. Getting too little sleep throws off your hormone levels. And remember, insulin is a hormone. So if you're not sleeping well, it's going to throw off your insulin. According to the National Sleep Foundation, ongoing sleep loss causes your body to release less insulin after you eat. Sleep loss can also increase levels of stress hormones like cortisol that can make your body resistant to insulin. So this can cause excess glucose in your bloodstream. So sleep as much as you can. I know that's not always easy with work and family and everything else, but it makes a big difference on how your diabetes, overall health in general. So I added this in because I thought this was pretty interesting. So sleep deprivation, which is less than 6 hours every night, increases your risk for cancer, increases your risk for becoming obese, weakens your immune system, increases your risk for heart disease, increased blood pressure, and can take about increases your risk of death overall because your body is not going to be functioning properly over time. So if it's like one night you skip out on a little bit of sleep, it happens, but if you're one of those people like myself, I'm a night person. I'm always up late. It's a bad habit. I work and go to school full time, so I sleep maybe 5 hours every night. But most of it's because it's my choice. I stay up really late. But it's not good for you. So if you can squeeze in more sleep, try to do that. And if you are diabetic, check your blood glucose. Blood sugar monitoring is the main tool you have to check your diabetes and to control it. If you have diabetes, you want to make sure that you're aware of what you eat and how it affects your body. So if you're not checking your blood sugar regularly, how would you know? You might feel different, you might not feel that good, but at least you would know. And you want to keep record of that so then you can discuss it with your doctor, or so then you can keep track of how certain foods spike up your blood sugar. If you're eating, well, you stay within your range of carbohydrates and sugar, you're exercising, your blood sugar can eventually become normal. It'll stabilize itself. But of course, if you're on insulin and medication, you want to incorporate those things into your regimen, but not stop your medication. And just to help anybody who is diabetic who does check their blood sugar, you always want to make sure you wash your hands first. That's very important. A lot of times people will take the test strip out of the little containers they come in, and then it can become contaminated. If you have oils on your hand, if you touch that tip where the blood sample goes in, you just don't want to do anything to contaminate it. So always make sure you wash your hands first, and then you can pull the test strip out to put in the meter. When using your lancing device, you want to use it on the side of your finger, but also don't let it touch your the test strip touch your skin once you're getting your blood sample. So try to it sucks in the blood, So you want to make sure you just put it close to the drop and let it absorb the blood, but don't push it up against your skin. Your blood glucose level will appear on the meter's display, and all meters are slightly different, but if you guys ever have any questions about how to test or if you're doing it properly, you could always speak with your doctor or your pharmacist. And that's just a picture that demonstrates what I said. It's really important to make sure you wash your hands. And then medication therapy. So people with type 1 diabetes have to use insulin. They don't make any insulin in their body, and that's what's different between type 1 and type 2, is their body just naturally does not produce insulin, so they have to inject it in order to use it. They don't have anything to use, so it has to be injected. The interesting thing about insulin is it actually comes from pigs. So pigs' DNA is close enough to our own that they're able to take the hormone out of a pig and make it into an injectable medication that we can use, and our body does accept it. Recently, they did start to make insulin out of human DNA that's mixed with bacterium. And the reason why they started to do that is because we can produce more of it. I mean, we're limited supply of pigs, so if they make it in the lab, it's something that they can make, and your body may respond to each one differently. So your doctor may try one insulin, switch it to another, and see what works best for you. People with type 2 diabetes can manage their diabetes with healthy eating and exercise. However, your doctor may need to also prescribe oral medications and or insulin to help you meet your target blood glucose levels. So some people may have to take an oral tablet as well as inject insulin. It just depends on how your diabetes is and how your diet is and how you are able to get that on a regimen to keep it normal. Insulin helps glucose move from the blood into your muscle cells where it can be used for energy. Some oral diabetes medicines help you make more insulin. So that's the difference between the two. So some people may need an oral medication because it's going to help them make their own insulin, or they have to inject insulin because they're just not making any themselves. So it just depends on what your doctor feels is appropriate for you. And medication adherence. So this is actually really important. Normally when I'm not out of the store getting to do presentations and I'm in the store doing patient adherence interventions. So I contact patients to see how their medication regimen is going, if they need refills, why they haven't picked something up, and just to see what's going on with them. When you're not adherent to your regimen, that means you're not taking your medication as directed. So you may take your medication once a day, every day, but you're supposed to take it twice a day. So that's a gap in therapy that we see in our system, and we want to see what's going on with that. But in general, if you're not taking your medication as prescribed, whether it's forgetfulness, which is really common, or maybe you don't like the way it makes you feel, maybe you dropped your blood sugar too low, those are things you would want to discuss with your doctor or your pharmacist to see what you can do to get your regimen on track with what's best for you. But adherence is very important. So if you have poor adherence, your medication is not going to work unless you take it. And if you're not taking your medication, it can cause a lot of problems with whatever type of disease you have, whether it's high blood pressure, cholesterol, or diabetes, which are the 3 most common diseases in America. So that's all I have for you today, but just a quick overview. When blood glucose stays too high for too long, serious health problems can develop. By controlling your blood glucose through diet, exercise, and medicine, you can delay or prevent kidney, eye, and heart disease and other complications of diabetes, maintaining your overall wellness. And if you guys ever had any questions about diabetes, about your health, even diet, Rite Aid actually has all of our pharmacists go through a certification to be diabetes specialists. Even if you do not fill medications at Rite Aid, you could always talk to one of our pharmacists and they would be more than happy to show you how to inject your insulin, how to test your blood sugar, and go over maybe a meal plan with you. And you can do that anytime at any Rite Aid, or if you don't want to come into the store, which happens quite a bit, you can call 1-800-RITE-AID, and we can walk you through it over the phone as well. That's all. Thank you.